Good afternoon again, guys. I want to share with you a fun piece of information that I stumbled across recently. One of the most common conversations that occurs in my office is discussing some ache or some pain with a patient, and it's not uncommon in a situation like this to hear something along the lines of, Doc, I took a few ibuprofen and my neck pain felt better, but then over the next couple days it started to get worse again. Or, if this pain doesn't go away, then I'll just pop a few Aleve, maybe an naproxen, maybe some Motrin. And this is something that is quite common. It's a common trend culturally when we feel a headache coming on or if that old nagging injury starts to flare up again. Many people, though, are aware of some of the side effects that come along with doing that, especially with ibuprofen. You hear about it. Don't take too much, you can have stomach problems, it can lead to ulcers. We know about these type of side effects with taking too many non-steroidal anti-inflammatory drugs. Some have even heard about the negative effects that it can have on the cardiovascular system and how it can affect the vessels. But what we don't hear much about is how NSAIDs with regular use can drastically reduce ovulation in women. You see, there's a hormone called progesterone, and this is a hormone that is vital to pregnancy, and it can really suffer if there's regular, consistent non-steroidal anti-inflammatory use. So it's something that we really need to be careful of, because from what I've seen, the scary thing is that these medications are prescribed and taken over the counter, sometimes like candy, with very little regard to the side effects. I've seen young athletes, young teenage girls who are just starting their menstrual cycle, popping these things for cramps like crazy. But the really cool thing in all of this is that there are natural alternatives for managing pain that don't come with a laundry list of negative side effects. Things that aren't going to mess up your hormone profile, but instead are going to work with your body's inflammation processing systems to better handle and process the pain. As always, recommendations are based on the individual's needs. So if someone you know are in pain, I encourage you to reach out to our office, give us a call, shoot us an email, message us on Facebook to discuss natural treatment options.